We are going to dive through about 5 or 6 questions today that were submitted via the private Facebook group. So we're going to be talking about stiffness. We're going to be talking a little bit about neuropathy, fibromyalgia, how to diagnose or to know if you have osteoarthritis, pain in the back of the knee, and then whatever else we can get to. So that's just kind of a quick recap. Okay, so I wanted to start off with just a common question that I get. And a lot of these questions are very common questions, which is why I like to do these question and answer sessions, because likely if somebody has this question, another person has it too. So if we haven't met before, my name's Alyssa. I'm a doctor of physical therapy, and I specialize in helping people with osteoarthritis find hope and adventure. So the first question, the more active you are, does stiffness decrease? And I kind of combined this with another question because it was along the similar lines of getting stiffness when standing too long, particularly in the hips. So first we're going to talk about does stiffness decrease when you are in better shape? And what happens? Why does stiffness occur, particularly when you're standing for a long period of time? Now, the more that you exercise and the more consistent you are with strengthening, doing the right movements, progressing those movements, and actually building muscle strength and muscle stability, stiffness can decrease. And I do want to open this up that if you have noticed your own stiffness decrease, because actually there's not a lot of research out there on joint and muscle stiffness, kind of why it happens in particularly regards to osteoarthritis. It's still kind of up in the air as to, what directly causes it and then if it can improve. But anecdotally, I hear from a lot of people, especially those that have taken my online course, the Arthritis Adventure Blueprint, building strength in the right areas, moving consistently, those two things can help decrease stiffness. Now, that being said, if you do continue to notice stiffness, it could be from a couple of different things. For example, a lot of people notice stiffness in the front of their hip. So in their hip flexor, the muscle that brings your leg forward, that could be from overuse. You may notice some tightness because you're using it too much, or it's trying to compensate for other muscles, and particularly the thigh muscles. So if that hip flexor muscle still remains stiff, still feels tight, then it could be potentially tied to some overuse. I see this a lot in people who primarily walk or even run for their activity. A lot of repetition in that forward motion without much variety or strength training can actually lead to some tightness there. But as far as joint stiffness goes, we do know that movement can help relieve joint stiffness. And that's one of the hallmark signs of osteoarthritis, is that this stiffness does tend to reduce after about 30 minutes of activity. Now, ideally, the more consistent you are with movement, and especially with the right types of movement, and not overdoing it, which is a hard balance to get to, then you would also notice a reduced severity of stiffness. Since stiffness is one of the hallmark signs of osteoarthritis, it likely will not go completely away. For example, if you're sitting for a longer period of time, or you're standing for just in one position for a long period of time, that stiffness may start to arise. But one of the things we want to look at is it decreasing in severity? So maybe after sitting for a while, before you started moving more consistently, you notice that your joint felt like a cement block. It felt like it was really hard to get moving. But then once your body starts to get used to moving, starts to use other muscles, and starts to get more blood flow, etc., you may notice that stiffness severity decreases. A lot of symptoms with osteoarthritis, we're not particularly looking at these things to go completely away, but we're looking to see if you can decrease both the severity and the frequency that stiffness happens, that pain happens, etc. That is one way that you can help to measure your progress, whether it's with, changing your diet, movement, etc. So ideally, your stiffness would decrease in severity. It would be a little bit easier to overcome the more fit you are, the more physically active you are. Now, of course, that's not going to go for everyone. And so it's definitely something just to watch for to see if you can decrease the severity of that. Stiff hips and standing too long, or stiff knees and standing too long, or stiff low back and standing too long. I actually just did a YouTube video about this, feeling stiff when standing, because it's a very common thing that happens. One of the reasons this happens, and there's been some research done, particularly in the lower back, when you're standing, particularly standing in one position, you may feel some fatigue, some discomfort, and some muscle tightness, some stiffness. And this is because as you're standing, in order to maintain an upright position, a decent posture, your muscles have to react and they have to work to keep you in one position. If these muscles, so let's circle back to the lower back, for example. If your lower back muscles and core, they're kind of co-contracting or contracting at the same time to keep you upright and to keep you in a relatively good posture. They're working that entire time. Now, if we have some weakness there, they can fatigue quicker and they can lead to some discomfort because essentially your body needs stability from somewhere. So initially, you may feel okay if you stand for the first maybe 5 or 10 minutes. You may not necessarily notice much discomfort, but then it starts to tighten up because when those muscles start to fatigue, then your body makes those muscles tight because it needs stability from somewhere, whether it's from contraction if they're strong, or it's from tightness because we're searching for that stability. So in the hip as well, it can kind of be the same way that your muscles are co-contracting. So for example, research has shown that glutes do a lot of work when you're standing. And so if we have some weakness there, which is really common, especially if you have hip arthritis or especially degenerative disc disease, some spinal stenosis, even in knee osteoarthritis, you may have some hip weakness. And if that allows for easier fatigue and it can't support you as well, then standing for a while may not feel very comfortable. One thing to kind of combat this immediately, because building strength does take time, is just trying to be as fidgety as possible when you're standing, trying to move, bend your knees, take your legs out to the side, just try to get some different movement into your joints to help relieve some of that stiffness, because then you're going to bring more blood flow to the area. It's going to cycle out some of those, I like to call them garbage cells, some of those inflammatory cells, and then bring in some new ones. So stiffness can be a common problem, but there are ways that we can reduce some of the frequency and reduce the severity of it with just some simple movements. Honestly, a lot of things, and I am biased being a physical therapist, but a lot of things do stem back to movement because movement is really, really powerful. And that's one of the biggest, most important things when you have osteoarthritis is finding the right types of movements. Okay. This next question I really liked because it's something we don't talk about very much, but she said, how do you improve proprioception? And this is not really a common question just because a lot of people may not even know what proprioception is, but it's essentially a fancier word for your body knowing where it is in space. So for example, if I have my hand and I bend it down, there we go. Like bend it down like this. Okay, so we can see on Instagram and Facebook. If I have my hand like this, but then I close my eyes, I know my hand is bent. That is proprioception. And some things can impair proprioception. And when it becomes very, very important is when it impairs it in your feet. And that can lead to some balance problems. Specifically, if you have diabetes and have neuropathy. So neuropathy is when your nerves and other things that help with sensation don't work as well. So we get a lot of input from our feet where we are in space. So what surface we're walking on, is the surface uneven? Are we going to hit something or trip over something? But when you don't have that, your muscles aren't able to react as quickly either. So when you're falling or when you trip over something, you have a delayed response. So then you're more apt to fall. So neuropathy can come from diabetes, but it can also come from a lot of other things, and it can kind of occur on its own. Proprioception is something that you can actually improve because actually our bodies are very resilient, and essentially we're trying to compensate. So if you do have neuropathy or you have numbness and tingling in your feet and or hands, shoulders, etc., or had a stroke or something that impaired your brain, that can impact proprioception too. Essentially, it just kind of jumbles your nerves a little bit and they're not able to give the right messages back. Anyways, can you improve it? Can you improve balance if you have neuropathy? And can you improve balance if you have some of these, jumbled nerves, etc.? And the answer is actually yes. And research has shown that you can actually improve proprioception. And you can do that through a variety of different balance movements. One study I was reading earlier today actually went through some balance movements, like typical ones that you would think of, like if you're standing on, especially if you've had physical therapy before, you're standing on like that piece of foam, that piece of blue foam, or standing on some like unstable surfaces like those balance discs and things like that. That is one way because you're essentially trying to get your body to react. So when you're on an unstable surface, your body is constantly trying to react and to correct itself. But there are other things you can do. And one study actually looked at when people were walking, but then they were like bouncing a ball or they were throwing a ball back and forth to one another. You're reacting to things. So, one thing I had people do in my weekly exercise class, and I'll put the link down below if you do want more information about that. Every Tuesday, I have a weekly arthritis friendly virtual exercise class. But what we were doing was standing in a common balance stance, like one foot in front of the other, that you may typically have heard of before or seen, but throwing actually like a resistance band back and forth, or throwing a ball, or you could try standing in a balance stance and bouncing a ball because you're trying to react, but while also being a little bit distracted. And this can be really helpful to improve some proprioception. So we have to, when it comes to proprioception, what I've kind of gleaned from the research is you have to take it a step further from just standing on one foot or standing one foot in front of the other. Those can be great places to start, but you have to add in some movement. You have to add in some distractions and some things that are outside of, you usually don't lose your balance when you're just standing on one leg or when you're just standing there one foot in front of the other. You're likely doing something or chasing something or being distracted by something. So it's important to also train that way. One last thing I want to mention about proprioception and just balance in general is a lot of times these sessions that they used, a couple of the common protocols were 2 to 3 times a week for 60 minutes a session. So it's not just enough to do a balance movement or two. It's better than nothing, but being able to challenge for like 10 minutes or being able to really, even just going for a walk and like taking a tennis ball with you and bouncing it. Of course, making sure that you are confident in your balance or you're with someone else. But simple things like that can be helpful when you're trying to improve your balance, and specifically this idea of proprioception, especially if you have neuropathy. So think about that the next time you're trying to do some balance movements or you're working out. Incorporate some different balance things and start to challenge yourself with some different things like that. Okay, now, number 3. How do I know if I have osteoarthritis or is it something else? So, in regards to knee pain, I think the question was. There are some different things to consider when being diagnosed with osteoarthritis. The hard part is there's not a specific test to say, oh, you have it, oh, you don't. So, it makes it a little harder, and you really have to kind of approach it on a big picture mindset. So, we have to kind of think of a couple of different things. And it's not just, oops, and it's not just the x-ray. So if someone looks at your x-ray and is like, yep, you have osteoarthritis, then that's not particularly looking at the whole picture. It is part of it. So there are some imaging things that you can see. Joint space narrowing is one of them. So you just kind of lose a little bit of the space between your joints, seeing some cartilage go away, or alter in, shape, size, you can see some changes to your bones, some kind of growths and things, some bone spurs, etc. That's part of it. But also another part of it is the symptoms that you actually experience. So if you think about if you're starting to have pain somewhere, one of the things with osteoarthritis is that it just kind of gradually comes on. Some people do describe that it feels like it just kind of came out of nowhere, but I likely that may not be the total picture, because you may notice like some aches or pains here and there, but you didn't really think anything of it. Then all of a sudden the pain is severe. This could be kind of the straw that broke the camel's back, and now you have more pain. So it likely is a gradual onset, and it doesn't have a mechanism of injury, meaning, oh, I fell, or oh, I twisted my knee wrong and now I have osteoarthritis. That is likely tied to some sort of injury, and it can bring on osteoarthritis later in the path, but it's usually not tied to a direct incident. So if you have like a direct incident of a fall, or you twisted wrong, etc., it likely may not totally be osteoarthritis. You may have had it before or something, at a very mild stage, but likely there's something else going on. Another thing is osteoarthritis is usually worse on one side compared to the other. You can, of course, have it on both sides, but if you notice that you do, so say in your hands, if you all of a sudden start noticing hand pain, but it's kind of in both hands, and then maybe you'll notice in both wrists or both elbows, that could indicate some rheumatoid arthritis side symptoms, that it impacts both sides basically symmetrically. Osteoarthritis typically tends to start on one side and then it can move over to another side, which is why it's important to strengthen and take care of it. But another thing with osteoarthritis is joint stiffness. So stiffness can be, like we just mentioned in the earlier question, ubiquitous when it comes to osteoarthritis. If you're sitting for a while, if you're standing for a while, or just being in one position, especially in the morning, that's kind of when they usually measure this time frame. So when you wake up in the morning, if you have joint stiffness, if it relieves within about 30 minutes of moving around, so I get up, I kind of stretch it out, move around, then it typically resolves in about 30 minutes. That's kind of the cutoff time for osteoarthritis. If you wake up and it's like, oh man, my hands or my knees or something, they feel really stiff for a while, so about an hour or even longer, that may be an indication of rheumatoid arthritis. So there are some different kind of symptoms that can overlap. So joint stiffness can overlap with a lot of different conditions, but just looking at some of the nuances in those symptoms can help to kind of dictate where we go and how we get a diagnosis. Another thing about osteoarthritis is pain is one of them, but pain is a symptom for a lot of different things. So we can't just use pain as a symptom, obviously, because it could be an injury, it could be a meniscus tear, it could be, in the knee, but it could be, a recent injury. It could be an injury to a tendon, like especially in the shoulder, the rotator cuff tendons. Those things can exist with osteoarthritis. But kind of looking at some of these symptoms, like, do you experience pain maybe more on one side than the other? Do you have stiffness? Do your joints make noises? So crepitus is kind of it's been described a lot of different ways: crunching, cracking, crispy, all kinds of different things. But crepitus can be a sign of osteoarthritis, particularly in the knee, but you may notice it in other joints as well. That could be a sign of osteoarthritis. Some tenderness, so when you're touching the joint, that can be a sign of osteoarthritis. You could have some intermittent swelling. If swelling kind of sticks around for a while, and it's one of the first things that you notice, or it's something new to you. Some people can have like recurrent stiffness, but if it's something that's new to you and it stays around for a while, then that may be an indication of a potential infection or something, especially if it's warm and it's hot, etc., red. So If it's new to you, then that would absolutely be something to get checked out. But stiffness is common with osteoarthritis, and a lot of times it's intermittent. So sometimes it's worse, and then sometimes it gets better, and it kind of follows that path. I have seen movement be really, really powerful when it comes to stiffness, or when it comes to swelling. So another chalk up for movement, but it's moving in different ways. So it's not just walking. A lot of times, if you incorporate some other movements, you can see a decrease in swelling. So essentially, it's just kind of looking at a bunch of different symptoms. Did you have an injury? If you did, it likely may not be osteoarthritis, or that may not be the particular cause of that specific pain or something you may be feeling. So if you've obviously had an injury where you've fallen or something, that would be something to go get checked out. But if you just kind of think about your global symptoms, I do have a blog post on this. If you go to keeptheadventurealive.com, my website, I have all sorts of blog posts, but one of them is how to diagnose osteoarthritis. So that may be something to check out there, just to get a little more detail on that. Talking about heat or ice, this comes up so often, and I really took a deep dive into the research this morning, and there's been some controversy over using ice, and some people are just can't decide heat or ice. Honestly, it comes down to a personal preference. And then it comes down to, I find a lot of people have more luck with heat than ice when it comes to chronic pain. So pain that kind of has lingered around for at least 3 months is typically the diagnosis of it. Then also, if you notice muscle stiffness or muscle tightness with the pain, then heat can actually help to reduce some of that stiffness. It basically increases blood flow, gets rid of some of the garbage cells again that you're trying to get out that are irritating your joint, wreaking havoc, and then it can cycle in some new blood. It can reduce some muscle tightness just to allow, it just acts on the muscles a little bit differently to allow them to relax, take some of that tension away. So most of people that I talk to do have luck with heat, but some people don't, and they really like ice. It comes down to a personal preference, and it really comes down to what your joints prefer, what actually works for you, whether it's a heating pad or an ice pad or an ice pack. There are all sorts of different things, but both can be helpful. I would try heat if you haven't. And then if it doesn't work or you just don't like it, then you can revert back to cold, but also you can use warm baths, etc. That can also be helpful. Okay, when we're talking about pain behind the knee, I had someone ask what maybe causes pain behind the knee, and then what to do about it. So pain behind the knee has a bunch of different causes, unfortunately. So if you think about the knee, there are a lot of structures. Even if you just feel behind the back of your knee, you feel some of these kind of knotty tendons, you feel some soft muscle tissue area. There's actually a lot that comes down and meets in the back of the knee. You have your hamstrings that come down, so the muscles in the backs of your legs come down and attach. Then your calf muscles actually come up and attach near the back of the knee too, and one of them actually crosses the knee. And then you have some just soft tissue tendon things. But then you also have something that can happen called a Baker's cyst. And this can commonly occur if you have knee problems, particularly knee osteoarthritis. It's kind of up in the air about what to do about a Baker's cyst in particular, just because cysts are hard because they can fill up and then they can kind of deflate. And they can deflate for a while, and then they can recur. And then they can deflate, and then they can recur. But it can limit your range of motion. You can also have a meniscus tear that impacts the back of your knee, your range of motion. So if you have some clicking, if you have some catching feeling, or you have some just tenderness along the joint line, so just right along, usually in the front of the knee, but you can also have a meniscus tear that can impact the back of the knee, but you'll mainly notice this when you're standing up, and you might not notice this at rest or when you're not standing and putting weight through your leg. You can have a tendon strain, so a lower tendon or a lower hamstring strain, where your hamstring comes down right at the bottom. This could be if you had a sudden increase in walking or running or hiking or walking up hills, etc. I mean, like a sudden increase where sometimes you usually walk a mile and now all of a sudden you walk 6 miles on, one day. That can sometimes lead to those lower hamstring strains, or if you've had a history of a hamstring strain, you're more at risk for redeveloping it. Weakness can also be a risk factor for this. So if you don't train the backs of your legs, then you may be more at risk for that. A calf strain is also something that can happen up near the back of the knee. This is, again, if you're looking at kind of a sudden increase in walking, a large increase in the distance you go, etc. This could lead to some hamstring strain or some calf strain. If you notice, you start to notice pain in the back of the knee, it could also be related to lack of range of motion. So if you can't bend your knee all the way, those muscles can get tight. But when you're trying to walk or trying to lay down where you're trying to have your knee straight, sometimes that can cause pain as well. So if you start to notice some of this pain, first I want you to think about volume. Did I do way more than I typically do, whether it's walking or just doing any sort of exercise? Volume can be a big proponent of that. And if that is the case, then, going to get an assessment from a physical therapist can be helpful. But it's also reducing some of that volume, but not completely reducing it to the point of rest. We have to find ways to move that aren't going to flare up that pain. If you notice pain and stiffness and tightness in the back of your knee, really starting to work to get that knee straight can be helpful. Not cranking on it, not putting a bunch of weights on it to try to get it straight, but trying to work through bending and straightening so that it spends more time being straight. That can help to relieve some of that pain too. So it really comes down to, is it the volume that caused it? Is it the range of motion that caused it? And if it doesn't really fall in either of those buckets, then absolutely go get it looked at just to see where we're at, because the back of the knee, there's a lot of structures. And so it can be hard to just say, back of the knee pain is this. It can be a lot of different things. And I do have a blog post as well on Baker's cysts. So if you go to my same website, keeptheadventurealive.com, and go to the blog, there are lots of blog posts, but one on Baker's cysts as well if you want more information on that. Okay, we have 2 more questions. So the next one is, does fibromyalgia happen with osteoarthritis? It can. Diving into the research on this as well, they can definitely exist together. So let's first talk about what fibromyalgia is. So fibromyalgia is described as a common widespread pain, and typically it's like musculoskeletal pain. So you have pain a lot of different places, and maybe it might move around, and it's based upon something called central sensitization, which essentially your whole body just becomes more sensitive to pain. Now, this is a totally real condition. It's not, something that's made up in your head. It's definitely a real condition, and there's a lot of research on it. The hard part is the treatment part of fibromyalgia, just because you have this chronic widespread pain. But it can also exist with osteoarthritis. And there's not particularly anything out there that I found recently about which comes first. Does osteoarthritis trigger it, or does fibromyalgia trigger it? But if you have, so say you have knee osteoarthritis, but then you start to notice pain other places. Now, you can see where this may get a little gray, just because osteoarthritis can spread to other joints, especially if you're altering the ways that you're moving, you're compensating. Knee osteoarthritis can then move to the hip and then can cause some back pain, etc. Fibromyalgia is more like you feel what it's been described as, you feel these trigger points, or you feel kind of these pain points that tend to kind of move around. There are some specific areas where you experience fibromyalgia, and if you want to just search I think if you just search fibromyalgia pain diagram or something, there are specific areas of the body that are more prone to being affected by fibromyalgia. And you can start to notice some patterns. But yes, they can exist together. And This can be something that if you've been diagnosed with, say, knee osteoarthritis, but are noticing pain elsewhere and it just doesn't seem like it's like like it just seems like something's wrong. And then maybe you just feel more sensitive to pain. Like you're much more sensitive than, say, someone else is in regards to different things, different activities, etc. Um, then fibromyalgia may be something that can happen, and definitely going to get that checked out by your primary care can be helpful, especially if you're noticing some of these other symptoms. Fibromyalgia can also be triggered by some physical stressors, some emotional stressors, or trauma. So if you've had a history of that, you may be more at risk for developing a condition like fibromyalgia. Obviously, it's not guaranteed that if you go through something, then you're going to get it. But that's also something to keep in mind, that if you have osteoarthritis, are noticing pain in other places, and maybe have a history of a trauma of some sort, or a significant emotional or physical event that has happened, that could be a trigger into fibromyalgia too. Fibromyalgia is treated a little bit differently, so that is one of the important reasons to kind of get that checked out and get that looked at a little further. Okay, last thing. How much recovery do I need between swimming and doing other sports like hiking and biking? First, I want to draw attention to these activities are all repetitive. I think specifically she asked about, she does 90 minutes of swimming, but then notices she has right shoulder, I think she said spasms or pain, she or he. If you are doing a repetitive activity, so all of these activities here, so swimming, you can obviously mix up your stroke too, that can help. But if you're doing like the same stroke as you're moving, or you're biking, that's one direction over and over and over again. And the last one is hiking. Hiking does have a little bit of variability compared to regular walking on like a hard surface, but hiking is also a repetitive motion of walking. Now you may change it up a little bit with hills, etc. But a lot of these movements are repetitive. And if you're noticing pain during these activities, more recovery may not be what you need. Usually, unless you're doing something that's very, very intense, or you feel, a lot of pain after doing something, or you've done a lot of something, then yes, some recovery is absolutely needed. But if you're doing something that's pretty leisurely, where you feel, say you hop on the bike for 15-20 minutes, whether it's a stationary bike or just, a bike outside, depending on how you feel after that, you may not need a ton of recovery, meaning like you have to wait 24 to 48 hours before you do any sort of activity again, if this is leisurely. So if you're doing an activity, I want you to think of a scale of 0 to 10. 0 is the activity is not difficult at all. You're resting, essentially. 10 is, wow, that was the absolute hardest thing I have ever done in my entire life. And you can see how this can be different for a lot of people. Like my number 10 is going to be different than somebody else's 10, and then different from somebody else's 10. So if we're kind of in that 8, 9, usually we don't really achieve the 10, but if you're in kind of that 7, 8, 9 range where, wow, that activity was really hard, you may need a little bit more recovery. And recovery doesn't always mean just sitting or laying down or spending time stationary. Just some gentle movement can really help with recovery, can help with muscle soreness, etc. Now, if you are experiencing a lot of muscle soreness, again, some gentle movement can be effective. But because you have muscle soreness also does not necessarily mean you have to recover for 48, hours plus. Doing some gentle movement, adding in some different movements. So let's go back to biking or swimming. Doing more swimming probably is not going to be helpful at the time if you're experiencing some soreness from that activity. But you can absolutely say, hop on the bike, or you can do some strength training movements that aren't going to really stress that same motion that you were doing. So recovery is a hard part just because some people may need a little bit longer. And some people may not need as much time. Typically, I work out every day for the most part, 5 days a week usually, and am totally fine. I find I don't really need much more recovery than, say, the about 24 hours that I have. So it's not necessarily a hard and fast rule. Like if you train legs, then you can't do legs for another 24 to 48 hours. Unless you have some very significant muscle soreness or you experience a lot of pain, that could be the exercise selection, um, not particularly that, you can't do legs anymore. If you're having pain, especially significant pain, that is your body trying to tell you something. Either change what you're doing or limit what you're doing. A lot of times it's just modifying what you're doing. So that doesn't particularly mean that you're not recovering enough if you experience pain. So a lot of times what I have people do is do a full body approach. So, doing a couple arm movements, a couple leg movements, and mixing in maybe some cardio or aerobic kind of all in one day. So we're not overly fatiguing one part of the body. And then moving into the next day, you kind of do the same thing. It's a couple of different arm movements, a couple of different leg movements, and then some aerobic and cardio. But if you're honest, if you're looking at some more of these repetitive activities, it's not saying not to do them, but you have to mix it up. So if you're doing, say, if you're swimming like 3 to 4 times a week and that's your primary form of activity, meaning you're doing like an actual stroke and not doing like water walking and things like that, you're in a very repetitive motion, mix it in with some strength training, maybe every other day, or mix it in with some movements that are going to work alternate muscles. Or mix it in with movements that are going to force you to move a little bit differently. Or maybe if you're doing swimming, then maybe focus on legs for the next day or focus on your lower body for the next day. It's not particularly how much recovery do I need if I have pain, if I have soreness. It's how can I move differently the next day to see some relief, to see some reduction in stiffness, see some reduction in soreness, etc. So typically around 24 hours is usually okay. Like I said, unless you're doing something super, super, super intense, you don't particularly have to worry so much about a specific parameter for recovery. Of course, your body does need to rest and recover. And as we get older, our recovery time lengthens a little bit. So just listen to your body. But again, like if you're noticing pain or significant muscle soreness, it may be the types of movements you're doing or the volume of movement that you're doing. It doesn't necessarily always indicate that you need more recovery. Also thinking about that active recovery to the point where recovery is not just sitting, it's moving, doing just very light things. It doesn't have to be intense, but doing some seated things, doing some light standing things whatever fitness level you're at. Being active in the recovery can be helpful to help prevent muscle soreness, because if you're feeling sore, resting is not always the answer. Complete rest is not always the answer. So I hope that was helpful. If you do have other questions, go ahead and comment down below. And then if you are looking for a way to get started on your osteoarthritis journey, find pain relief, make adventure possible, I am going to put a link down below to the Arthritis Adventure Blueprint, the free web class that's going to give you the 3 secrets to adventuring with osteoarthritis. You're going to learn more about the Arthritis Adventure Blueprint program. And you're also going to learn what has worked for other people along the way. So you can go to arthritisadventure.com to learn more about the Arthritis Adventure Blueprint. If you just want to say, screw it, I want to get started right now. But if you want to join the free web class and learn more about it, go to keeptheadventurealive.com/web class. Or you can just go to my main website page and you'll see a link on the homepage to check out that free web class. Okay, well, thank you so much for joining me. I hope that this was helpful and enjoy the rest of your day.